After fighting many battles, CRPF has taken up the challenge to beat the raging COVID pandemic. At least 115 personnel have lost their lives so far, and now the forces have set up an ICU facility in Delhi to ensure the best medical care for the soldiers. Let's see this report.
The second COVID wave has spared no one, not even our security forces. CRPF, which is at the forefront of anti-terror operations and law and order duty, has by far been the worst hit. 115 CRPF personnel have lost their lives, though recoveries have been nearly 20,000. Now the force wants to ensure that every soldier gets the best medical care. CRPF has set up an ICU facility in Delhi's Jaroda Kalan with 400 quarantine beds. The mess has now been converted into a state-of-the-art medical facility with ventilators and oxygen cylinders.
After the onset of the second wave of coronavirus, CRPF quickly realized that they didn't want their soldiers to run from pillar to post either for oxygen or the quarantine centers. So here we are in Jaroda Kala, and you can see behind me, these are prefab huts or the prefabricated huts which have been created, and inside are the isolation wards.
There is scarcity of the beds in the civil hospitals, and our people, they are running helter-skelter from one post to another post, couldn't be finding the beds. So better we thought of, we have the infrastructure, we have the capacity, we have the manpower and the specialists. So this is our old hospital. So we found it proper to say create ICU facility with the backup of the composite hospital.
A new hospital would have taken time, but realizing that the situation would soon turn grim, CRPF has worked at makeshift but concrete arrangements to ensure their staff are not left in the lurch.
With the support from the MHA and under the guidance of our DG, so we started the expansion of Jaroda facility, and this is 8 prefab huts with a capacity of 80 plus beds. They call to the control room get in touch with the families, and whatever help is required, whether it is the oxygen or ambulances or the hospital admission or admission in our own COVID care facility.
तुरंत मेरे क्वार्टर पे एम्बुलेंस पहुंची और मेरे को यहाँ लाया गया और कुछ मेडिसिन दिया। उसके बाद मेरे को टेस्ट कराया गया जिसमें मेरा पॉजिटिव आया। उसके बाद मेरे को यहीं कंपोजिट हॉस्पिटल में एडमिट रखा गया। 11 दिन में एडमिट रहा और बहुत अच्छा यहाँ खाना वगैरह अच्छा मिला, पौष्टिक आहार मिला और किसी भी परेशानी कोई प्रॉब्लम नहीं आई और अभी बहुत अच्छा लग रहा है, एकदम फिट हूँ मैं।
India today witnessed the work on a war footing at the COVID center. Most of the wards are already ready and buzzing with patients and doctors in PPE kits.
इतने कम समय में अथक प्रयासों से सीआरपीएफ ने एक बहुत उत्तम दर्जे का कोविड केयर सेंटर बनाया है जिसमें लगभग 72 बेड्स की सुविधा उपलब्ध है।
The number of active cases in 7 paramilitary forces stands at nearly 10,000, while over 60,000 personnel have recovered till now. With forces running vaccination drives on a war footing, they now seem better prepared to take on the COVID challenge. With Kamaljeet Sandhu, Bureau Report, India Today.